Hi, this is Dr. Kevin Smith. Thank you very much for checking out this video on why you can still have low thyroid symptoms even if your blood tests are normal and even if you're taking thyroid replacement hormone. In this video, in Hidden Secret number 18, we're going to talk about overconversion of T4 to T3 due to elevated testosterone. Testosterone is a sex hormone. It's produced by both males and females. And if you have too much testosterone, what it does is it upregulates the formation of 5' deiodinase in the liver. 5' deiodinase, what it does is it helps to convert T4 into T3. Most of the thyroid hormone coming out of your thyroid gland is T4. 93% of it is T4. Only 7% is T3. T3 is the active form of thyroid hormone. T4 is the inactive form. So T4 then goes to the liver and it gets converted to T3 through this, by use of this enzyme 5' deiodinase. If you have high levels of testosterone, what that does is it makes too much 5' deiodinase, and that overconverts the T4 to T3. So what that looks like on labs is you have normal TSH, you'll have normal T4, and you'll have high T3. And that may actually cause low thyroid symptoms. Why would that be? Wouldn't it make sense that if you had elevated levels of T3 that you would have high thyroid symptoms or hyperthyroidism? Not necessarily, because if you do this enough times, what happens is that the cells in your body, they have these little receptor sites for T3 hormone, and they become kind of blunted to all this onslaught of T3. They just get bombarded with T3, and as a result, it eventually starts to backfire and it drives the hypothyroid response. So people that have elevated testosterone will overconvert, they'll have too much T3, and then they'll suffer with low thyroid symptoms such as constipation, diarrhea, memory loss, brain fog. You just don't have any energy whatsoever. You feel like you have to sleep all the time. You feel cold all the time. You maybe have thinning hair or dry brittle hair or cracked fingernails, and so they'll suffer with all these issues. So what's the root cause of this? Well, elevated testosterone is frequently caused by testosterone creams that a lot of men may use, and when women come in contact with the men, it may rub off on their skin and then they absorb it, and that drives the process up. It's also due to people that insulin resistance. That seems to be the root of all evil that we talked about in these different videos. People that have insulin resistance may have elevated testosterone, and in women that have too much testosterone, it's often linked with PCOS, polycystic ovary syndrome. So you have to make sure that you are getting your sex hormone levels checked for women. Not only do you have to make sure that you have a good balance of estrogen to progesterone, but you have to make sure that you have a balance of estrogen to testosterone. And in females, if you have too much testosterone in your system, that could be the root cause of why you could have low thyroid symptoms. Well, thank you very much for checking out this video. If you have any questions about this, please feel free to send me an email and communicate with me through my website at integratedmetabolic.com. Please subscribe to my YouTube channel and please tell a friend. Thank you very much for checking out this video.